Good morning, this is Talia Mason, and this is my clinical to class presentation. This is the case study. A 52-year-old male presents to the ER with the chief complaint of burning stomach pain that gets worse when I'm hungry. The patient reports that this intermittent pain started 3 months ago. Other symptoms reported include epigastric pain 2 to 3 hours after meals, nausea, occasional dark and tarry stools, unintentional weight loss of 8 pounds in 2 months, and bloating. The patient's past medical history includes 20 years of smoking, drinking 3 to 4 beers daily, and chronic use of aspirin for osteoarthritis. His vital signs on admission was a blood pressure of 132/86, a heart rate of 94, respiration rate of 18, temperature of 98.8 degrees Fahrenheit, a pain of 8 out of 10 in his lower upper quadrant of the abdomen. On assessment, he reported having mild epigastric tenderness on palpation, black tarry stools positive for occult blood, and no abdomen distension or guarding. These are the lab values for this patient. The hemoglobin is 10.2 grams per deciliter, which is low and suggests GI bleeding. The hematocrit is 31%, which is also low and suggests GI bleeding as well. The white blood cell count is 7,800, which is normal. Platelets are at 285,000, which is normal. The BUN is 29 milligrams per deciliter, which is high. The creatinine is 1 milligram per deciliter, which is normal. The H. pylori antibody test came back positive, which suggests H. pylori infection in the stomach. And the fecal occult test came back positive, which suggests active bleeding in GI. Based on the lab values and assessment of the patient, these are the diagnostic studies that have been ordered. An EGD, it resulted in a 2-centimeter duodenal ulcer with a clean base. Biopsies were positive for H. pylori bacteria. An abdominal ultrasound. The results were normal and there were no gallbladder pathology present. A urea breath test. Results positive, confirming active H. pylori infection. The medical diagnosis for this patient is a duodenal ulcer resulting from peptic ulcer disease related to H. pylori infection and chronic NSAID use. These are the medical treatments that have been prescribed by the physician. We have clarithromycin 500 milligrams by mouth twice a day and amoxicillin 1 gram by mouth twice a day. Both of these antibiotics are bacteriostatic and ensure that the cell wall of the H. pylori bacteria is being destroyed so the infection is completely going away. And next we have pantoprazole 40 milligrams by mouth twice a day. This is a proton pump inhibitor which reduces stomach acid secretion, and this is to be taken before meals. Then we have ranitidine 150 milligrams by mouth twice a day. This is an H2 receptor. It also reduces stomach acid secretion, but this is more of a immediately acting and short-term medication versus the proton pump inhibitors give more long-lasting effect. Then we have sucralfate, which is 1 gram by mouth once a day, 1 hour before meals and at bedtime. This protects the lining of the stomach. And then we have antacids, PRN, which could be like an over-the-counter medication like Tums, just to reduce indigestion. These are the nursing interventions for this patient. We want to monitor vital signs. We want to look out for tachycardia and hypotension, which can be a result of GI bleeding. We want to evaluate the pain, get a verbal pain scale going from 0 to 10. We want to check stool for melanoma. We want to assess liver and kidney function by monitoring the BUN, creatinine, AST, lab values. A lot of these medications are excreted through the kidneys or the liver, and so we want to monitor these functions. We want to monitor the hemoglobin and hematocrit trends to assess for active GI bleeding. We also want to provide smoking and alcohol cessation resources, as smoking and alcohol use are exacerbating the peptic ulcer disease. We want to also monitor for perforation of the ulcer, which could present with sudden severe abdominal pain. We want to monitor for hemorrhage, which could present as hematemesis, severe melena, and dizziness. And we also want to administer IV fluids if ordered to replace electrolytes. This is the client education that I'm going to provide for peptic ulcer disease. First, I want to encourage them to finish the entire course of antibiotic treatment. Because the peptic ulcer disease is also related to H. pylori infection, it's so important that the patient finishes the entire course of the antibiotics to make sure that that infection does not reoccur or moreover develop into a super infection, which is a worse infection than what they already have. I also want to encourage them to avoid foods that increase stomach acid like caffeine, alcohol, and spicy foods. The patient should also discontinue chronic use of NSAIDs. Chronic use of NSAIDs can cause GI discomfort and also cause ulcers. I also want to encourage them to avoid smoking and drinking alcohol, as this can cause to exacerbation of peptic ulcer disease. I also want to tell them to take the proton pump inhibitors in the morning before meals, because it is to be taken on an empty stomach. I want them to report black stools, vomiting blood, or severe abdominal pain immediately, as these could be signs of an emergent exacerbation of peptic ulcer disease and active GI bleeding. I also want to tell them to manage their stress and avoid late night meals. As a nurse, I am diagnosing this patient with inadequate nutrition related to decreased intake due to pain, nausea, and early satiety, as evidenced by 8-pound weight loss. The interventions include monitor daily weight, encourage small, frequent, high-calorie meals, administer antiemetics if nauseated. The goal is for the client to maintain nutritional needs and have a stabilized weight. I'm also diagnosing them with ineffective health maintenance related to lifestyle factors such as smoking, alcohol use, and chronic NSAID use, as evidenced by the patient statements. The interventions include providing patient with smoking alcohol cessation resources. I also want to educate the client on risk of chronic NSAID use and provide alternative pain relief therapy for the patient. The goal is for the patient to cease to smoke, drink alcohol, and avoid chronic NSAID use. This is question 1. As it states, a client is started on triple therapy for H. pylori infection. Which combination indicates the prescription is correct? A. Pantoprazole, sulfoxaflate, bismuth subsalicylate. B. Omeprazole, clarithromycin, amoxicillin. C. Ranitidine, metronidazole, tetracycline. D. Sulfoxaflate, famotidine, metronidazole. The correct answer is B. Omeprazole, clarithromycin, and amoxicillin. Antibiotics to treat the H. pylori infection, and a proton pump inhibitor to reduce irritation of stomach lining from stomach acid. Question 2. It states, which instruction would the nurse include when teaching a client about preventing exacerbations of peptic ulcer disease? A. You may continue taking ibuprofen for headaches. B. Limit alcohol intake to 1 drink per day. C. Avoid smoking as it slows ulcer healing. D. Drink milk frequently to coat the stomach. The answer is C. Avoid smoking as it slows ulcer healing. The rationale is smoking increases acid production and delays healing. NSAID should be avoided. Alcohol should be reduced or avoided, and milk is no longer recommended. It increases acid production. Question 3. As it states, a client with peptic ulcer disease is prescribed sulfoxaflate. Which instruction should the nurse give? A. Take this medication with meals. B. Take this medication 30 minutes after your proton pump inhibitor. C. Take this medication on an empty stomach. Or D. Take this with milk to increase absorption. The correct answer is C. You should take this medication on an empty stomach. The rationale is Sucralfate coats the ulcer and works best when taken 1 hour before meals on an empty stomach. This is my list of references. This case study for peptic ulcer disease relates to MedSurg because patients with peptic ulcer disease need inpatient medical care due to active GI bleeding risk, which in that case, fluids and electrolytes need to be replaced to increase their blood volume. And also, IV or PO antibiotics are needed to be administered to treat infection of H. pylori bacteria. That is all for my clinical to class presentation on peptic ulcer disease. Thank you.